Today, I want to talk about some of the myths around using vaginal estrogen. I often get patients in the office saying, I don't want to use vaginal estrogen because dot, dot, dot. So let's go over the top 3 reasons. I'm Dr. Prabakar, board certified OBGYN, and let's get to the list. So, number one, patients often say vaginal estrogen causes cancer. False. Vaginal estrogen does not cause cancer. We have sufficient data and studies to back this up. So, vaginal estrogen is very safe. Number two, vaginal estrogen is the same as hormone therapy. False. Vaginal estrogen is a completely different type of therapy compared to regular hormone therapy. Hormone therapy goes through, your entire body, and it is to treat systemic effects and symptoms of menopause, versus vaginal estrogen is a very local form. And number three, well, I'm already using systemic estrogen. I can't use vaginal estrogen. That's also false. You can use vaginal estrogen along with systemic estrogen to help you with all the symptoms of menopause. So these are the 3 most common myths of vaginal estrogen. Number one, that it's going to cause breast cancer or some other type of cancer. Number two, that it's the same as regular systemic hormone therapy. And number three, that you cannot use it with systemic hormone therapy. These are the top 3 myths. Tomorrow, watch my next video to see how to apply vaginal estrogen. Let me know if you have any questions, comment below.